So the SPRINT trial was a primary prevention trial testing intensive systolic blood pressure lowering. So treating blood pressure to a goal that was lower than what was the standard of care at the time. So 120 millimeters of mercury versus the standard at the time, which was 140. And so this was, back in 2015 that it was published, and the primary outcomes were cardiovascular outcomes, but there were some additional studies that were part of it, including SPRINT Mind, which was looking at cognitive outcomes and whether participants with a more intensive blood pressure treatment would develop dementia. And then there was an MRI sub-study. So a cohort of the patients underwent MRI at baseline prior to treatment, and again, about 4 years later. And so, this analysis was focused on those individuals who got MRI. So what we looked at, so the primary, results from the MRI study was that intensive blood pressure lowering actually helped slow the progression of white matter hyperintensities, which are sort of the most well-studied marker of cerebral small vessel disease. And so, but we were focusing on subclinical infarcts. They're also called covert infarcts or silent infarcts. And, they can be either cortical. So like somebody who has AFib may have an embolic stroke and may have what looks like a cortical infarct on an MRI several years later, or they can be subcortical or like lacunes. And lacunes are sort of another classic marker of small vessel disease and are associated with hypertension. And so, but we looked at both of them combined, as well as also combining clinical stroke, because there were 8 of these participants who had clinical stroke during the trial. And so we combined subclinical infarcts and clinical stroke to see if intensive blood pressure treatment would reduce either new clinical stroke or finding a subclinical infarct in the follow-up MRI. And so, that was the first part of the study, was looking at that, and we didn't find an overall effect across the whole group. But, the other question that is interesting is, how do you, if you see a subclinical infarct in somebody on an MRI, how do you manage that? And that's a question that, is still up for debate for several aspects. Well, we know that you should try to address all of the risk factors, hypertension, diabetes, and make sure that sort of all the primary preventative measures are in place. We really don't have a well-defined blood pressure goal for these people, and people have debated on antiplatelet therapy, the extent of how much workup you do to figure out what caused these lesions. So, at this time, they're sort of in the middle of being considered just, an incidental imaging finding, or, versus like what a clinical stroke would be, where you definitely act on it and treat it a certain way. And so that's what this part of the study was to address, is intensive blood pressure treatment, good for people with subclinical brain infarcts. And so what we found was that for those who had a subclinical brain infarct at baseline, the intensive treatment actually reduced the risk of having another either clinical stroke or another subclinical brain infarct. And so, a caveat is the numbers are pretty small. There were 60 who had follow-up, who had a baseline infarct and follow-up MRI. And while some of them had clinical strokes, there were actually no new MRI lesions in those who had baseline subclinical infarcts in a follow-up MRI. So that's where the significant results were seen. So that was the first part, looking at new infarcts or new strokes as an outcome. And then the other outcome we looked at was whether they had MCI or dementia follow-up. So, or mild cognitive impairment or dementia, probable dementia. And so that was a combined outcome. We know that in the larger group of like 9,000 or so, intensive blood pressure lowering reduced the risk of this combined outcome of MCI or dementia, which was a secondary outcome. But it wasn't significant on just probable dementia alone. But so we focused on MCI or dementia, and having a subclinical brain infarct at baseline increased the risk for having MCI or dementia at follow-up. But there was no effective treatment for those people who had subclinical brain infarcts. So there wasn't sort of the same, we didn't see the same effect we saw with new ischemic events. And, so that's the gist of our study. But I think, in conclusion, I mean, the subclinical brain infarcts are very high risk markers because they increase the risk for new ischemic events, either subclinical or clinical. And they also increase the risk for having MCI or probable dementia follow-up. And so at least for preventing recurrent subclinical brain infarcts or new clinical stroke, it seemed like intensive blood pressure treatment was beneficial. And, so that sort of, so it seems like it's a good idea probably to treat these people with intensive blood pressure treatment lowering.